Okay, thank you very much, everybody. We'll begin. My name is Robin Harding. I'm Tokyo Bureau Chief for the Financial Times, and it's my pleasure to moderate this press conference today. I'll carry on, and I hope we'll get Professor Iwata back in a moment. We'll pause for a second. If you can hear us, Professor Iwata, we've just lost you from the screen, so we're just waiting to get you back. Okay, you're back. It's my pleasure to introduce today Kentaro Iwata, Professor of Infectious Diseases at Kobe University Hospital. Professor Iwata is one of Japan's most distinguished experts on infectious diseases. He's worked around the world with some of the biggest outbreaks of infectious disease, SARS, Ebola, etc. He caused a stir yesterday when he published a video on YouTube about his experiences on board the Diamond Princess cruise ship. We thank him for joining us today via Skype. In a moment, I will ask him to make some introductory remarks, but first, just a few housekeeping rules. First, the language of today's press conference is English. I will allow a few questions in Japanese at the end if we have time, but please, basically the language today is English. We're doing this via Skype, so we particularly need your cooperation to make sure this runs smoothly. We may have some technical problems during the press conference. I hope you will bear with me. Please try to talk slowly and clearly so Professor Iwata can hear you properly. And if you have a follow-up, please signal to me, don't shout out. If we have several people talking at the same time, this will turn into chaos. And with that, I would like to turn it over to you, Professor Iwata,
yes,
to make some introductory remarks, whatever you want. Thank you.
Okay, thank you for coming. And as introduced, my name is Kentaro Iwata from Kobe University Hospital. The remarks I will make from now at today's conference is all personal and does not represent the views of Kobe University or other bodies where I belong to. As you might know, that I posted a YouTube both in Japanese and English regarding the Diamond Princess. Basically speaking, the principal opinion I wanted to express was a lack of adequate infection control inside the cruise ship. 2 days later, this morning, the opinion is largely the same. The problem was fundamental, and that is probably based on the lack of more fundamental or systemic issue, which is lack of CDC, which exists in most nations, but not in Japan. So that is what I expressed. And if you want to ask me some questions or raise suggestions, I'm very happy to answer you.
Okay, we'll move to questions. Let me first just acknowledge Nico Nico Doga, who have provided the facilities to allow us to run the video today. I saw David McNeil's hand go up. David, do you want to go first?
Hi, Professor. Thanks for coming along. David McNeil for the Economist. Mm-hmm. I think the first question has to be, you took down your original video, or you appear to have taken it down. Would you care to explain the reasons why you did that?
Okay. This morning, I removed my posts, both English and Japanese version, and I completely removed all of them. It's because just the post became so viral and viewed by so many people. And yesterday, I was informed that the significant improvement was done inside the cruise ship, and the zoning, which I had a huge concern, had an improvement for the better circumstances. Also, on the same day, yesterday, Institute of Infectious Diseases in Japan published the report showing the data of the cruise infections. And this is what I suggested over last a week or so to Ministry of Health and Labor, which is the openness and transparency and the disclosure of the data inside the cruise ship, which was never been done. The news coverage showed the number of the people who got tested and who got the positive, and you could have seen, today's number of tests was 66, and out of 66, 44 turned positive, kind of thing, which doesn't mean anything to me because the date of the tested and the date of the result came in, it doesn't mean anything in regards to the spread of the infectious diseases inside the cruise. So what you need is the onset of the symptom of each patient who developed the coronavirus infection and the date of that. If you see the curve, which is called epi curve in a professional term, then you will distinguish between the infections occurring before February the 5th and after the February the 5th. And that is extremely important because unless you know the fact how many secondary infection was occurring when and where, you can't really conduct proper infection control management. So that was what I thought was lacking, and the thankfully Institute of Infectious Diseases published that yesterday morning, and turned out the most of the Japanese passengers didn't have the secondary infection after February the 5th, although there were infections among crews, which is likely to be a secondary transmitted. So because of these two, one with the improvement of the zoning inside the cruise ship, and second, the disclosure of the data to show the about the fact about the secondary transmissions, I thought my role of the YouTube post is over. There's no need for spread the opinion and ask for the to be aware of this issue because the issue is gone. And so I thought we don't need to discuss any further regarding this, and I removed the post. So that's my answer. Did I answer your question?
Okay, another question, gentleman opposite, David. You give your name and affiliation, please.
Thank you, Doctor. My name is Nakano. I'm freelance.
Yes.
I have a question.
Sure.
After posting your statement on YouTube, before you removed it, have you felt any pressure from anyone like Dr. Takayama or Gaku Hashimoto or other colleagues of yours?
I don't know who's Dr. Hashimoto.
Oh, no, that's Gaku Hashimoto.
Oh, unlike what he posted, I've never seen Mr. Hashimoto, not inside the ship and not outside the ship. Honestly, I didn't even know whether the politician named Mr. Takashi existed until yesterday afternoon. So let me make it clear regarding this misunderstanding. Probably he saw somebody other than me. Anyway, Dr. Takayama, we had a number of communications back and forth over the telephones, over the text messages, and many of them were very technical. So I can't really go into the detail about this, but I never felt any pressure from him in terms of you should do this, you should do that kind of thing. He asked me to remove the post 2 days ago, but he never had any pressure on it. As I said, I don't know Mr. Hashimoto personally, so I don't get anything from him.
Okay, Motoko.
Thank you so much for speaking to us, Dr. Iwata-san. Have you changed your opinion? Oh, I'm so sorry. I'm Motoko Rich with the New York Times.
Yes.
Yesterday you said that you had concerns about the passengers who were leaving the ship, that they might not, in fact, be virus-free despite testing negative. Have you changed your opinion since then?
Well, largely, I don't change my opinions as of now in many topics. One, the problem with the zoning. Second, the problem with the secondary transmissions. Although after seeing the data of Institute of Infectious Diseases yesterday, I think the risk of passengers to have a secondary infections now will be tremendously reduced than what I feared before viewing that data. So I'm very glad to see that. But still, because there were crews who got most likely a secondary infections after February the 5th, that means there's still a room of potential exposure of the virus from these crews who might be spreading the virus before the diagnosis is given. So the risk is reduced, but the risk exists. So I think my opinion probably would not change. My opinion was these people who were disembarked yesterday or maybe today should be monitored for next 14 days, possibly avoiding the contact with other people, maybe soft isolation kind of things at home, and be aware of the possible onset of the disease later on. Any other things you want to ask me regarding the change of opinion? Because I can't remember all of the things I said.
Do you want to follow? No, we can move on to the next question. The gentleman here.
Sure.
My name's Kyle Cleveland. I'm with Temple University, Japan. You said that your views on this have changed somewhat from yesterday to today. And some of your comments yesterday seemed to indicate a lack of trust in what the authorities were doing. You're receiving a tremendous amount of pressure through social media and other ways. Can you explain in more detail to the extent to which your thinking on this has changed and why?
What do you mean by change?
Well, you seem to have a more qualified response than you initially did in a very short period of time. So are we properly understanding that your views on this have changed or not?
I don't think I changed my views in a large perspective. For example, so I don't know whether I understand you correctly. So, which specifically do you want me to comment on? I still don't get it. Sorry.
Oh, I'm sorry. You had indicated earlier that you think some of the protective actions that are now being taken are better than they might have indicated from what you initially saw.
You mean the number of the secondary infection? No? Sorry.
I think, if I'm understanding Kyle's question correctly, I think we're wondering if you've changed your opinion about what you saw on board and your concerns about the lack of
about
infection
zoning
control.
and the secondary infection. No, I don't change my opinion in terms of the risk of the secondary transmission by the practice I saw 2 days ago, and which was totally chaotic and which was totally outrageous and which was completely bad in terms of the professional infection control measurement. Even with the reservation of which is cruise ship, not in hospital, and which is the temporary measures, which is emergency situations, I could understand a lot of circumstances which might undermine the completeness of the infection control measures. But still, you decided to keep more than 3,000 passengers and crews inside one very closed box or cruise and keep for 14 days for potential transmission to occur inside while having many infected people inside. So the infection control measures have to be very, very thorough and very professional and very complete. And I didn't see any of these. And I don't change my mind in terms of that. So that's still, I think my view still holds.
Okay, lady over there.
Hi, my name is Ariel Buzetto with the English side of Sankei Shimbun. You said that you were told that the conditions were improved. I was wondering if you could elaborate. I imagine you can't say too much, but I was wondering if you could elaborate a bit more about what has improved and perhaps even who has told you this.
I can't say who told me so, but I could tell the significant improvement was given as the improvement of the clear alert zoning. And also I became aware that the number of the infected people among passengers were declining in terms of the epi curve. And so the total risk on board would have significantly changed since yesterday. Also, I was informed that the persons from Institute of Infectious Diseases returned and became dislodged as the specialist team, I think. So a couple of things I thought was inadequate has changed yesterday. So that is my understanding right now.
Okay, Surya.
Hi, Dr. Iwata. It's
Hello.
Surya from the Wall Street Journal. Nice to talk to you again. Just a couple of questions. You mentioned that you looked at the data and you noticed that the Japanese passengers were not prone to secondary transmission, and perhaps the crew are. What about the others? What about all the other passengers on board?
According to my observation, up until 2 days ago, I think other people who were on board, such as DMAT persons, the officials of Ministry of Health and Labor, the quarantines, these people probably placed themselves at danger of receiving a secondary transmissions because of the infection control problems. And it is still true right now. But because of the change occurring yesterday, the risk might have been significantly decreased. Still, because of the incubation period, you might see the onset of the disease among those people from today and on. But at least the new infection occurring from today would not probably occur, I expect.
Sorry, I just have one more question.
Sure.
Do you wish you had more support from the Japanese government for what you were trying to say?
Yes. I always need the support from anybody.
Thank you. Let me ask a quick question about the passengers who got off. The US, Hong Kong, Australia, other countries are all saying that these passengers need to go into quarantine for another 2 weeks. Do you think that should be done in Japan? And if not, why not?
I think people in Japan should follow what the people in US and Hong Kong and Canada and South Korea is doing, i.e. 14 more days of isolation. But, it depends on the level of isolation, I would say. But you need to have some sort of monitoring for the next 14 days at least. And ideally isolated in an isolated environment, because of the risk of secondary transmission. I think it's real, and if you allow secondary transmission to occur in a community, that would lead to the tertiary transmissions and the spread of the disease. As you might see, there are a number of the people who got infected with this COVID in Japan, but still the infections are really isolated and restricted to the certain areas such as Wakayama, Tokyo, and Hokkaido. And we don't see infections in Kobe, we don't see infections in Saga, we don't see infections in Aomori. So many places in Japan are free of infections as far as we are aware of. So it's a time of the small cluster period where your aim is to contain the spread of the disease and ideally eradicate it. In that sense, you don't give up on allowing the new infection to occur in any circumstances. So some people might say, Japan is full of infections now, so why do you care about the cruise ship? There's no point in making an effort of the border screening and closing. But I don't agree with that view, because we still need to fight against this disease in every effort and containing the spread of the disease. And once you allow the spread of the disease, then even if you were doing a good job up until now, then you'll have to return to the zero period again and do the same thing again and again. China is very aware of the risk of the respread of the infection from now on, because they are returning to work, and that might allow the resurgence of the infection. We can't allow the same here in Japan.
So your advice to passengers who have got off the ship is that the responsible thing to do is to isolate yourself for the next 2 weeks?
That's my suggestion. But on the other hand, we have to be very careful not to accuse these people who might develop symptoms and potentially who might spread the disease to some others, because they were just following what the government recommended. So the respect for the privacy, respect for their ID, and the kindness to these people who unfortunately could have infections later on is likewise very important, I think.
Thank you. David, there's another mic there.
Sorry, David McNeil again.
Yeah.
Would you care to extrapolate from what you saw on the ship yesterday to express any concerns you might have about the way that the disease is being, or the outbreak is being contained in Japan in general, around the country?
Around the country? Not in a cruise ship?
Yes, aside from the cruise ship. Any concerns you have around Japan?
Around Japan, well, I had been saying before the cruise ship program, I had expressed my opinion of the Japan's government had been doing a fairly good job up until cruise ship. And they were really monitoring the disease, and they prepared the medical care, and they prepared the laboratories, and they follow the sort of contact tracing. And so so far, I think Japan's doing a very good job for almost everything except for cruise ship and potentially a Wakayama epidemic inside the hospital, which I have another big concern for now. So I think for this period, Japan should continue the same thing unless there is another phase of the infections occurring in some other areas.
Could you elaborate on the Wakayama hospital?
We have very few data on Wakayama hospital, so I cannot make a big comment on Wakayama. But again, I would like to have more data on a daily basis. So how many people got traced, and how the infections occurred, and how many were at risk, and so on and so on. Then also, I'm very interested in healthcare personnel who got close contact with the infected people. Are they still working in a hospital, or are they isolated? These concise information I'd like to have, and everybody should share with, while keeping each person's privacy very secret.
Thank you.
Thank you. Good morning, Professor Iwata. Rocky Smith from Reuters. So you yourself are in a kind of self-imposed isolation. Could you describe to us in maybe a bit more detail about the precautions you're taking, your daily life, as maybe a model for what you're recommending these passengers to do as they go into, as you say, soft isolation? Okay.
First of all, I never recommend what I'm doing right now to any of the passengers. Well, At least yesterday, I had to respond to so many interviews from morning to midnight. So now I'm scared of developing a disease other than coronavirus infection now. I'm putting myself on a self-isolation because I thought I stepped in the red zones while not protecting myself, i.e. PPE. That is the most dangerous thing to do as an infection prevention specialist. And I'm not scared of getting disease myself because I know that 80% of cases it's just a common cold, and only the small minority of people would get pneumonia, and very few would die of this. But still, I'm very scared of spreading this disease to others as the responsible doctor. I don't want my family to get the disease, not to mention my patients. I'm not going to take care of my patients from 2 weeks from the day I left the ship. So this is my responsibility rather than for my health or safety. But I think I need to contemplate on what has been done over last 2 days and seek some sort of the improvement in what I could do from today. That's also another thing I'm thinking of doing.
So do you plan to stay in this same hotel room for the next 2 weeks? How do you plan to eat?
I can't tell that for sure for now. And I'm not going to tell where I'm staying, and I'm not going to tell where I'm going to stay tomorrow. Let me keep this as a secret to you.
Okay, Motoko.
Thank you, Dr. Iwata. It's Motoko Rich again. I wonder if you could expand on why you took the video down, because so much of what was in the video, you say you haven't changed your mind. And it seems like it's an important point that needs to be out there about infection control measures on that ship as more and more passengers disembark and as other countries make decisions about what to do with returning passengers.
Okay, I removed my post because, first of all, my intention, as seen in the end of the video, is to change what was happening inside the cruise ship. And my intention was not to criticize anybody personally. Therefore, I never mentioned any person by name to criticize or accuse anybody. That was not my intention. But a lot of people misunderstood me, saying that I am trying to accuse somebody personally or institutionally. That's not my intention. And leaving my posts on the YouTube would allow a lot of people continue to misunderstand me and trying to develop some fissure between me and the other bodies, which I have no intention to. I would like to be very friendly to everybody, and I would like to be very rational. I would like to have the scientific discussions with anybody to improve the situation and make this problem better. That's my intention. Very unfortunately, I didn't have any chance to have a discussion with anybody inside the ship because I didn't have any allowance of speaking and removed from the ship. So that's my regret, the biggest regret. If I could have the time to talk, then I could have suggested the improvement, which I think was needed then. After posting to YouTube, thankfully, the zoning changed, and the structure of infection prevention inside the cruise ship changed, and now we know the transmission dynamic of coronavirus infection inside the cruise largely. So I think the role of the YouTube is over, and to avoid further spread of the misunderstanding and the unnecessary division of the views or the hostile exchange of the opinions, I just decided to remove everything.
Motoko, is that okay? There's a question on the next table.
My name is Karin Nishimura from AFP. I have two questions. The first one is, do you think that you play a role of whistleblower in this case? And the second question is about the WHO, who ask people not to overreact because the spreading of the disease is almost in China and not so much in other countries.
Yes.
Do you think that in any sense Japan, by cancelling a lot of events, is overreacting to the spread of the disease or not?
Okay, for the first question, I don't know whether I play the role of the whistleblowers, but traditionally I think Japanese don't like whistleblowers of any kind. So I don't know whether I could have played a role, but things changed yesterday anyway. So I'm happy with the change. Whether that change will lead to the improvement of the fundamental problems such as lack of CDC, I don't know. People could become rather adamant on what they are. So maybe the structure like CDC would be gone by now and in the future. That I'm very sorry about, but we'll see. For the second question, I agree with WHO that people should not overreact. As I said, Japan's spread of the infectious disease is rather limited to several places. I still have a big concern whether that small cluster of the diseases would lead to the large expansion of the infections, which could happen. My intention of fighting against this disease has never changed since the beginning of this program, which is never produce a second Wuhan in Japan. If you produce the circumstances like Wuhan now, which is just a disaster, very bad disaster, and it is almost uncontrollable to anybody, you should avoid that. If you allow millions of people get infection with this virus, then thousands of people will die. There's no way to prevent the infection to get severe. So the government says you have to prevent the severe cases, but because there's no way to block the cases to change from the light to severe, you have to prevent the case to occur. If the number of the cases is small, the proportion of people who get severe case would be small. But if you get tens of thousands of people get sick, then a certain number of people will get a severe disease. Excuse me. So so you have to be have totally different opposite views at the same time. You have to be very careful, but you have to be calm all the time. At least in Japan, there's no need for the restricting any events or restricting a commuting, restricting a walking outside. I don't think there's any need for that as of now. Whether that will lead to the finish of this disease epidemic, I don't know yet. And we have to be prepared. But so, you see, we have to be extremely cautious, but we shouldn't panic. That's my opinion.
Okay. Do we have more questions? I can see a hand up over there.
Is this working? Oh, okay. Radio from Japan Times. Thank you very much for talking to us today. I have two questions.
Sure.
Watching your video, I thought your key message is your concern about violation of protocol of worker,
yes.
how to use the protection gear. if you wear the protection gear in a clean zoning, any zoning would have meaning, right? So I thought that was your key concern. So what about now? So what kind of have you seen any improvement in about these issues, or after seeing the data of the passenger yesterday, or still concerned about this behavior of the people in the ship? This is my first question. Second question, I think you have argued Japan needs something like a CDC.
Yeah.
Could you elaborate more about your argument, and what shortcoming do you see in the current system in Japan? Thank you.
Okay. So for the improvement of the zoning and the infection prevention, because I had never been allowed to enter to the cruise after 2 days ago, I haven't seen myself what is happening now, but I was informed that the significant improvement about the zoning was done, and I'm very happy to hear that, because I didn't want to see far more infections among medical care personnel, ministry officials, and crews and others. So that is my view. For CDC, so you need to have a concrete, separate, independent system among experts who can make a decision in responding to these infectious disease epidemics. And this has to be professional. They need to have authority. They need to have autonomy, and they need to have a clear independence. There shouldn't be any cross-cutting from anybody from the backyard, because I've seen many things are decided behind the scene, and we never know who decided and how it was decided, and what is happening inside, and who were discussing with whom, and the reason and rationale for each decision making. Everything is in a dark zone in Japan. So we never know what is happening, and we never know why it happened. That's not a good scientific decision making. And if you avoid scientific decision making, that will lead to the wrong decision making all the time. That could be a sensational decision making, that could be an emotional decision making, that could be a political decision making, and this decision making is not very good in mitigating the real risk of infectious diseases, which should be dealt purely scientifically to protect people's life. Also, the scientific decision making is good in regards to preventing social problems such as prejudice, discriminations. We, Japan, suffered from a lot of these social issues in terms of the infectious diseases in our history, such as leprosy, HIV infections, and so on. We should avoid that. The leprosy patients were isolated because of the wrong view of prejudice by seeing the people's face, and they wanted to isolate the people. Scientifically speaking, leprosy is not contagious to anybody in normal life, so you shouldn't isolate these people. Therefore, scientific decision making is very important in protecting human rights and avoid these unnecessary discrimination. Back to CDC talk. So again, scientific decision making, independent body, and the autonomy and authority is needed, and China has it, South Korea has it, because East Asia tended to have a tendency to decide things backwards, but people are beginning to change. Japan has never changed yet. I think we should.
Thank you. Any more questions? Okay, there's a question on the far table.
申し訳ないんですけど、ちょっと日本語で質問させていただきます。
はい。
外国特派員クラブ巡回員の。
Well, sorry. Before you're allowed to ask a question in Japanese, are there any more questions in English?
Right. Any more questions?
Yes, another question on this table, please.
Dr. Iwata, thank you for joining us today. I'm Mari Yamaguchi from AP.
Yes.
I want to kind of follow up on the previous question, and I was wondering, what do you think of the problem that you saw on the ship originated from? Was it because of the bad examples of scientific decision making in terms of the crisis management that was happening on the ship? And what do you think could be used as a lesson from what you saw on the ship into the the rest of the?
Thank you. I think the simple answer is the lack of CDC, as I said before. Why the situation inside the cruise ship had an inadequate infection prevention, I think, is because of the lack of principle. So the infection prevention needs a principle, and the principle will lead to the procedure, not the other way around. What I think is the people initially implemented zoning, implemented infection prevention procedures, implemented the PPEs, so they did prepare a infection prevention management. And I think they think, and they still think, they are doing a good job. To me, it was not good enough, because there was an exchange of the dirty and clean, there was a confusion about the role of PPE, there were allowance of the crews potentially infected walking around. Again, remember I said, well, there were not many secondary infections, but actually there were secondary infections among crews, and which we shouldn't have a complacency about. You can't say, well, that's a cruise, so it's okay, kind of things. You can't say that. So the number of the issues were based on the lack of principles, which is to distinguish between dirty and clean clearly, because virus is invisible. So unless you have a principle in dividing these clean and dirty scientifically, you can't have a clear distinction between these two. Even if you put many things on the manual, this is the green zone, this is the red zone, this is PP, that could be violated very easily unless you have understanding of the clean area and the dirty area. That was very clear in, for example, Africa when we were fighting against Ebola, but it was not in Diamond Princess, and that's the very reason I got scared of getting the infection myself. So the principle will never be given by the bureaucrats, because they never had infection prevention training, they don't have experience, and they don't have a system. So, and CDC should have all of these. So this is how I feel.
Okay, there was one more question. There's two more questions on this table, and then I will allow some in Japanese, and your question as well, sir.
ちょうど NHK によると
No, we haven't moved to Japanese questions yet.
I'm sorry. Karina Nishimura from AFP. Yeah, we just learned from NHK that there has been 2 people from the cruise ship who are announced dead. Any kind of reaction? For example, comparing the number of deaths in China, sorry, and the number in other countries, especially in Japan, regarding the number of positive cases, please.
Because the total number of the people who got infected in Japan is relatively small comparing to the one in China. Because of the very small denominator, the small change in the number of the people who are dead would hugely change the percentage. For example, if you had 100 people who got infected and you have 1 dead, if it becomes 3, that will become 3%. So the small change in the death case would significantly change the percentage. So it's too early to judge in Japan whether there was change in the mortality comparing to other nations, including China. I don't know the detail about these cases because this is the first time I heard about. So I can't really comment on the specific in that point regards.
Okay, Surya.
Dr. Iwata, Surya again from the Wall Street Journal. Just a quick question. You talked about crew. You talked about your observations about the personnel on board. You talked about how some of the Japanese passengers did not look like they'd had secondary transmission or that they weren't infected from the secondary transmission. What were your observations about the other passengers, having read the report that you've just read?
Other passengers?
Yes.
In terms of transmission?
Yes.
Well, I don't know. Shortly, so we have hundreds of asymptomatic people who the onset is never known. We will never know the exact onset of these people who got the detection of infections asymptomatically. So we don't know about that, and we don't know much about about more than 100 people who have no data regarding the onset of the symptoms. So we have several things we still don't know. Also, we don't know whether or not they will develop a disease from today and on. So I can't say from the report of the Institute of Infectious Diseases yesterday was very reassuring, but as they themselves admitted, that didn't answer all the questions and concerns with what we have right now.
Okay, could those who want to ask questions now clearly raise their hands, please, so I can see where the questions are. So I see 3 here on these tables, 4. Okay, we'll go round this way. So you go next.
Okay. Hi, Dr. Iwata. It's Dennis Normile of Science Magazine. Thank you for your time on the phone yesterday. Your video appeared late in the evening on Tuesday. And on Wednesday, the National Institute of Infectious Diseases posted this information on its website. Do you think the appearance of your video pressured the National Institute of Infectious Diseases to release this data?
I think so. But I don't think they will say so either.
Okay. The gentleman down the table, you pass the microphone down, please.
Hello, my name is Shogo Takagi, belongs to Mainichi newspapers. I'm not good at English, so I ask my question firstly in Japanese and say it in English. Okay?
No. I will give you a chance to ask a question in a minute in Japanese. You pass the mic. We'll move to the question over here.
Hi, Arya Buzetti from Sankei Shimbun again, the English side. I just have a question on moving to the issue of quarantine in general. I'm just interested, if I understand correctly, you say that you're not against quarantine, but you say that the way that it was done was incorrect. Is that my understanding is correct? Then the second thing that I would like to ask is, you said that you had experience with like Ebola in Africa and so on. I was wondering if you could give a bit more detail on the kind of standard that you saw and what you were therefore expecting to see on the ship, apart from the green zone and red zone thing, which you mentioned before. And thirdly, I was wondering whether you have plans in the future to work together with, collaborate with your contact at, for example, in the government, or do you have any plans to try to help with this crisis at all? Okay.
For the quarantine, yeah, I agree with you. I'm not against quarantine, but I'm not saying you should quarantine people either. The decision making inside the cruise ship is extremely difficult. So if I were in charge of this case, probably I had to think thoroughly what to do on February the 5th when the person were identified to be infected. Cruise ship is really a difficult place to protect people. So it's a structural problem. So we have to decide whether to release people outside the cruise or to keep inside the cruise. The former would cause a lot of people in the city to have a secondary infection, so that has a shortcoming. But keeping people inside the cruise ship could allow people inside the cruise ship to have a spread of the infections further. So either scenario has a shortcomings, and the decision making can be very, very difficult. However, if you decided to keep people inside the cruise ship and isolate and put on a quarantine for 14 days, that has to be very, very thorough and has to be very complete, because if you allow the secondary infection to occur, then that would become a day zero again, and has to isolate the people for another 14 days. That could be very painful to everybody. And to reassure the procedure of the 14 days quarantine, you have to keep the data updated every day and monitor it and make sure there's no secondary transmission every day. And that was not people in charge doing, and I criticized for it. Thankfully, the data came out yesterday, so that was good. But looking back, it should have been done every day just by updating data since February 5th. So the things were done in terms of the epidemiological data management. I think it was not completely proper. What was the other questions? I'm sorry.
About your experience.
Oh yes, Ebola. And so I was a family physician in Beijing, China, and seeing several people who could potentially have a SARS case. And also I was the infection prevention specialist working for WHO when I was in Sierra Leone. Again, I did a lot of works, but again, you have to have a clear distinction between where the virus could potentially be and where the virus doesn't exist inside the facilities. That could be a hospital, that could be a tent, that could be a ship, and that could be a cars, because the ambulance needs this kind of distinction too. So a lot of application of this principle exists. So some people might say this is a big cruise ship, so the infection prevention management inside the hospital doesn't apply to the cruise ship. That is technically true, but the principle is the same. Principle is to divide between dirty and clean. And you have to follow that principle, and you have to modify your techniques and apply that to everywhere you go to protect people, including the healthcare personnel. And for example, in Africa, in Ebola, most people were treated inside a tent developed by UNICEF and other bodies. But that tent was completely defined as a red zone, and people were not allowed to enter into that red zone without wearing a PPE. And upon being out of that red zone, then you have to remove PPE very correctly with 2 people by somebody watching, monitoring, and it has to go out without PPE as a green zone. And keeping that procedure accurately would prevent further transmission to occur, particularly among healthcare personnel. Green-red distinction is very useful in protecting healthcare personnel and the others entering to the red zone. It's nothing to do with the secondary transmission among passengers and crews. So this has to be clear.
Okay, one more question from AFP, and then we'll have some questions in Japanese.
Yes, the last question is to confirm your opinion on the possibility that a negative test turned positive a week ago or some days ago.
Yeah?
Some days later, sorry. Someone who has been tested negative.
Yes.
If you do another test 1 week ago, is there a risk that this test is positive?
Yeah. There's always the wrongness of the test. That could be technically wrong, and that could be essentially wrong. And there's no test which is 100% accurate and 100% sensitive. So that could be falsely negative. And we have to be aware of that potential danger of that. So the test negative is not no infection. We have to know it. And therefore, we have to utilize the test result wisely. Excuse me, to interpret the result very accurately. Otherwise, we might release people who might have infections. So that's very important.
That may have happened because, for example, people who left the boat yesterday, some have been tested on 12. So it means 1 week ago.
Yeah, but to me, it doesn't matter because I don't care about the test result anyway, to begin with. You might have a test negative because while being infected. Also, you might have a new infections 2 days later. So you could have a lot of scenarios you could consider. But still, as far as you remain being wise enough to know the test negative is not a no infection, your decision is easy. You have to keep a watching of this person for next 14 days. Regardless of the test result, regardless of the date of the tests, that doesn't matter at all.
Okay, the gentleman from Mainichi, please, you can ask in Japanese now.
ありがとうございます。日本語で質問させていただきます。今の質問の関連になると思いますが、昨日岩田先生は、立憲民主党のヒアリングで、その、新型コロナウイルスの検査の感度は、ほぼ30から 50% だとおっしゃったと思います。で、この、データの、根拠を教えてください。今はその、日本政府はとにかく、テストプラスが感染者であるという定義をしていますので、そうでない人がいない、内感染者とかいないわけですが、どういう意味でそういうことをおっしゃっているのかを教えてください。
はい、まずテストポジティブが感染者だっていうのは正しいです。テストが陽性であれば正しいとみなしていい。で、30から50というのはこれ上海か何かの報道だったと思います。で、その時にその中国のデータでは感度は30から 50% でしたっていう報道が中国語でなされていたと思います。ちょっと手元にデータないですけども。で、この後もっといろんな地域でのいろんな感度特異度が出てくると思いますが、いずれにしても検査陰性で後で感染があったって分かるケースはたくさんあるので、いずれ出てくると思います。May I speak in English regarding his question now?
Yes, please.
His question was about the source of the data showing the PCR sensitivity of 30 to 50% I cited in the past. I cited from one of the Chinese papers who described these situations in Shanghai, and the doctors inside the news described the sensitivity of the test, meaning among 100 people with disease, the test was positive from 30 to 50, namely the sensitivity of 30 to 50%. Probably from a lot of new data coming in from now on, more data will come in. And the new sensitivity will be known. But largely speaking, the sensitivity is not very high in this disease. So you can't trust the negative result of this infection.
You can't, I believe you said. First, just for gentlemen at the far table who I cut off before, do you want to ask your question now? No, because... No, don't shout. If you don't want to ask the question, that's fine.
Thank you very much. The management's question is covered my question. So
thank you.
Okay.
Thank you. So
thank you.
Next, the gentleman, not you, but gentleman behind you.
お疲れ様です。ニコニコ動画の七尾と申します。本日はありがとうございます。先生に質問2つございます。今ですね、速報で、政府関係者によりますと、これ NHK のニュースなんですが、新型コロナウイルスの集団感染が確認されたクルーズ船の乗客でウイルスに感染していた80歳代男性と女性合わせて2人が死亡したことが分かったという、こういうニュースが流れております。クルーズ船の乗客で死亡が確認されたのは初めてですというニュースです。これにつきましてコメントもしありましたらお願いします。
はい。 今のところ何のコメントもないです。さっき同じ質問をいただいたんですけど、まだそのケース出たばかり、私も詳細存じませんし、今は特に何もコメントはありません。クルーズ船の中の方って高齢者の方が多かったので、あるいは持病をお持ちの方も多かったので、一定の割合で亡くなる方出るっていうのは想像されてたんですけど、なんて言いますかね、驚きがあるかというと、驚きはない、そういう可能性っていうのは十分想像されたと思います。His question was regarding a two mortality occurred and broadcasted by NHK this morning regarding two persons in 80s died of COVID infection and who were a passenger of this cruise ship. And then he wanted my comment on this, and I said, well, I don't have any specific comments right now because I don't know any detail about these cases, but because cruise ships do possess a lot of elderly passengers, and many of them do have chronic diseases on medications. So whether I was surprised by this news or not, my answer is no. There's no surprise in seeing a death case because they are the high-risk patients. We don't have a specific treatment proven to be effective against this disease, and it is possible to have unfortunate mortality among many cases who got this infection.
ありがとうございます。2つ目です。新型肺炎のですね、感染経路、感染力のことについてなんですが、中国で新たなガイドラインが発表されましたけれども、この中でそのエアゾル感染が起きる可能性があると指摘されております。で、これを受けてですね、東北医科薬科大学の各特任教授がですね、エアゾル感染は、電車やオフィスなどの通常の生活関係空間で起きるものではないとおっしゃってるんですが、例えばですね、今日もその暖房の効いた満員電車で激しく咳き込んでいる人が出勤している光景を目の当たりに私しました。先生の16日に書かれたブログのですね、ちょっと具体例を見た感じなんですけど、今回のそのウイルスの感染力というのはSARS、MERS と比較して先生はどうお考えていらっしゃいますでしょうか。
ちょっと質問が若干どちらかというように見えるんですけど、エアロゾルについて話せばいいですか。
そうですね、まず一つそれをお願いします。あと感染力、全体的な感染力の話で。
エアロゾルは咳では起きません。エアロゾルは空気感染ではありません。で、各先生がおっしゃるように、エアロゾルは、特殊な環境下でたまに一過性に起きるもので、めったに起きません。また中国のガイドラインは、エアロゾル感染が起こりうるとは書いてると思いますけど、起こったことが確認されたとは言ってないと思いますので、これは区別が必要だと思います。His question was about the potential aerosol transmission of the disease, and it is widely broadcasted and put on a Chinese guideline. Aerosol, and he was concerned about getting a disease by aerosol, for example, inside a packed train in Japan. That doesn't happen because the coughing will never produce aerosol. Aerosol is totally different concept, which is produced by very rare, unusual situations like virus infection with vomiting that was scattered on their floors, and with some sort of the accident that would develop aerosol kind of things, which rarely happens or it may never happen. So you don't have to worry about the aerosol infections inside the train or the bus or on the road. That is very unlikely to occur. Second question was the comparison of transmissibility of COVID and SARS and MERS. COVID is very funny virus. Coronavirus is very peculiar virus, and the transmissibility of disease depends on not solely depends on the viral characteristics, but also depends on the human nature, like whether you wear a mask or not, you walk around or not, and you were with other people or not. Society is also one of the determinants, whether you have a lot of traffic system, whether you have a huge populations, whether you have a small housings, whatever. So we often mention basic reproductive number, the number of the people newly infected from one person. That is not a scientific. I mean, that's a scientific number, but that's not a biological number. It's not just a biology, but the social life, human behavior, a lot of things could affect the R0 or basic reproductive number. So the basic reproductive number in China may not apply to the situation in Japan, for example. I don't know whether probably coronavirus infection is, I think, more transmissible to comparing to SARS and MERS because this produces much milder disease. So you can walk around. SARS was very severe disease, so you couldn't walk around. MERS, likewise. So the viral characteristics of developing mild symptoms for next 5 to 7 days, which is a very peculiar characteristic of this virus infection, would allow people to not be mindful about the symptoms and not be aware of the problem and may continue to commute and go to school and stuff like that. That's why Japan's government specifically cautioned the development of upper respiratory tract infection. So even if the symptoms could be mild, you have to keep yourself at home. You have to give up the typical Japanese mentality of working hard even if you are sick. That should go. You have to be at home. You have to be wise. Maybe you can work with your cell phone or computer at home. So we have to change. Shortly, I think coronavirus infection, for many reasons, is more transmissible than SARS and MERS.
Okay, we're basically out of time, and the questions are no longer about the Diamond Princess. I will allow one more question, if it is about the Diamond Princess, from the Japanese media. Yes, sir, on that far table there.
すみません、NHK の安土と申します。船内のゾーニングが改善されたということなんですけれども、これそうお感じになる根拠をすみません、ちょっと改めてお聞かせいただけますでしょうか、日本語で。聞いた。これは
そういう情報をしっかり筋から得たからです。His question was regarding the improvement of the zoning inside the cruise ship, and he was wondering why you think it was a significant improvement. That because I was informed by somebody who I trust and who knows the detail about the zonings, and I was given the direct message from him who was inside the cruise ship yesterday that said there was a significant improvement.
すみません、どういう説明を受けてなぜそうお感じになったのか、もう少しご説明いただけますか。
それはちょっと言えません。
そうですね、わかりました。ありがとうございます。
One more comment. The significant improvement means there was a significant room of improvement 2 days ago. You see, unless there was a room of improvement, you can't improve anymore. So some people say that Japan's infection control was perfect. There was no lack of problems and everything was going well. That's not true. It changed in one day. It changed significantly, meaning it had a room to change a lot. So they were proving themselves that there was a problem 2 days ago.
Okay, thank you, Professor Iwata. You have thoroughly answered our questions. We appreciate it very much. And I think we should draw it to a close there. So I hope that maybe one day you'll be able to come back to this club in person and speak to us, not over
Unless
Skype.
I survive.
we all wish you the best. Thank you very much. And with that, this is adjourned. Thank you.
Thank you very much.